Hello everyone, my name is Dr. Joel Rosen. I am an adrenal fatigue recovery ninja, and today I want to talk to you about gluten-free diets and adrenal fatigue. If you are suffering with an adrenal fatigue issue, whether you have difficulty having energy sustained throughout the day, you have a lot of inflammation, you can't stabilize your blood sugar levels, have difficulty falling asleep, you get stressed very easily, or you don't handle stress very well, so we have anxiety, irritability whenever a little stressor is incurred in your day, then many times trying to adopt a gluten-free diet will help, because gluten-free diets don't expose you to a very common food allergen that will cause a reaction and inflammation in your body. So what will happen is many patients that we consult with are told or tell me that they've done an allergy test, they did a skin fold test, and they tested their skin for different allergens, and they found out that they didn't have any allergies to gluten, or they had an allergy to maybe dog hair, or they had an allergy to peanuts, but they didn't have any allergies to dairy or soy or egg or whatever it may be. And so they've gone ahead and they've started to eat gluten. And the problem with number one having a skin fold test is it tests an IgE antibody, which basically means it's an immediate reaction. And so that's like saying I speak Cantonese, but I don't speak Mandarin. And what I mean by that is just because you test for an IgE antibody doesn't necessarily mean you don't have a food sensitivity. And so there's a difference between a food allergy and a food sensitivity. And that's what gluten testing is to determine if you have a food sensitivity. And so basically what happens is it tests an IgA and an IgG immunoglobulin or white blood cell that is your way of producing antibodies to certain harmful antigens that your body comes in contact with. So what will happen is many patients will go to LabCorp and they will get a gluten test, and usually they only test one type of peptide structure, and there's about 24 different peptide structures, and so they are told that they have a false negative test when they didn't test all of the different possible types of reactions that you could react to. That's number one. Number two is you'll go gluten-free because you know you have a gluten reactivity, and you start to go to the gluten-free section and you start to eat gluten-free bread, you start to eat gluten-free pasta or gluten-free crackers or gluten-free beer, and you think you're doing a great job and you're being very proactive, but yet you still suffer with adrenal issues, or you still suffer with fatigue, or you still suffer with energy problems, or you're unable to lose weight. The problem with that is that there's called a cross-reactivity. The antigen or the peptide structure of the food is so similar to gluten that the antibody will be produced and create a reactivity. So we do a test called Cyrex Labs, and the Cyrex Labs is testing for these common cross-reactive foods like rye, barley, spelt, Polish wheat. Those aren't actually a gluten peptide, but they're similar. So if you have rye bread because you're thinking it's not gluten and you have a positive response to that, then you are creating inflammation every single day that you eat it, and that inflammation is draining your adrenal glands. Cow's milk. But there's not only one peptide structure, there's several. There's cow's milk with IgA and IgG. There's caseomorphin, or there's casein alpha and casein beta for IgG and IgA. So you can see all of these different peptide structures. You may test negative to one, but you may test positive to another. And it's not like when you drink milk, you're only drinking one type of peptide. You're drinking them all. So you can't just selectively remove the ones that you aren't reacting to. And you need to do complete tests to know which ones you are reacting to. There's also oats, yeast, coffee, buckwheat, sorghum. For me, I was reactive to gluten, and I went on gluten-free products, and I had a gluten-free beer, and the beer is made with sorghum, and I was reacting to sorghum. So I no longer do that. Millet, hemp, amaranth, quinoa. Oh, back to back to the peptide structures in dairy, whey protein. A lot of patients that I consult with take a protein powder every morning and they take whey, and I can't tell you how many times I've seen an adrenal patient react to whey and have no idea that they're reacting to whey, and they're eating it in every single food that they have a protein powder with. Quinoa, tapioca, teff, soy. I think most patients should be off of soy. It's all GMO'd anyways, and there's estrogen problems, but there are food reactivities to soy, and that means you have an intolerance to it. Corn, rice, and potato. So what I tell patients is when you have a positive test, it means that that food is off the plate. That means you can no longer eat that food. However, there are sometimes a false negative test, which means 85 to 90% of the way we react to a food is by producing an antibody. However, there is also a way that we produce a reaction without producing an antibody. So that means that you have a false negative test. You tested to the food, it was negative, but meanwhile you do have a complementary immune reaction, and that can still drain your adrenal glands. Because really, food reactions create inflammation. Inflammation is settled by your adrenal glands in order to sort of calm the immune system down, and then ultimately, done day in, day out with all your other stressors that you have to deal with, will drain your adrenal savings account, and then next thing you know, you have HPA axis issues, you have coordination issues, you have an absolute amount of cortisol being released issues, and all of these are causing your problems. So the important thing that I tell patients to do is to remove the food for about 4 weeks, 4 to 6 weeks, even if you tested negative. And then when you reintroduce the food, you're going to reintroduce one food every third day, and you may have reactions. You may have anxiety, or you may have palpitations, or you may have skin irritations or itchiness, or you may have gastrointestinal bloating and pain, and you may have constipation or diarrhea. You'll know when you remove the food for long enough periods of time if you're reacting to them. And if you're reacting to them, then you're creating inflammation, and that's draining your adrenal glands, and you need to remove the food. So hopefully you got a little bit out of this video today. You understand that going gluten-free is not necessarily being reactivity-free, that you should do in the very least, a removal diet so that you remove the food for up to 6 weeks and see, once you reintroduce it, are you actually having a response? And you'll find in that time that you probably feel better, you have more energy. Then that's a good chance that you had a food reaction. There's other things that we do to try to clean up the gut and help the liver and reduce inflammation. That's for another video. But hopefully you liked what you heard, you learned a little bit. If you did like what you hear, please give me a share, a thumbs up, a like, a comment, and be sure to check out my video or my blog over at adrenalfatiguesociety.com, and I look forward to helping you in your recovery for your adrenal issues. Thank you so much.